Hey guys, it's Sleep for Tink again, and yeah, it's really bright in here, so I might get washed out a little bit, and that's fine. I wanted to do a video today about the psych test, failing the psych test to be more specific, and I know firsthand about failing that psych test. So first, let's talk about the purpose of the psych evaluation. If you're doing bariatric surgery or in the process of it, a lot of different hospitals will require that you have a psych examination done to make sure you're mentally ready for weight loss surgery. It wants to make sure that you have a support system and you're mentally stable to handle having the surgery. Let's see. What is the evaluation? So I know some places will do just a one-on-one talk, and if that talk goes well, then you're good and your psych eval's done, and you know, they clear you to go ahead. Some places, like my place, we did a one-on-one talk, and then after that talk he wanted to do this test as well. And I know there are different tests. I had to take one test was like 567 questions, and the other test was over 200 questions. So yeah, and then that test gets sent off to some lab where they break down everything, and it's all based off of how other people have answered the test and how they've done the surgery. What it might mean if you fail. And these are some things that, you know, after going over my psych test with the psychologist, that I heard. Alright, so it was saying that the probability of me having a success a year out, having the weight loss that they wanted, you know, based off of the percentage of how much you would lose from the surgery, the chances are that I would fail that. Negative body image post-op, so they could say that, you know, you wouldn't like your extra skin after surgery. You could say if you don't have a support system, it tells if you have faith as part of your support system, and then it can tell if you're depressed, which, you know, a lot of overweight people are depressed, and that's not something that will disqualify you, I guess, depending on how depressed you are. So for my results, it said that I would have a negative body image after surgery, which I think is odd because I don't really have a negative body image now. So that I don't have a support system. It said that I had faith and that would help me, but it also said that I was depressed and that overall I would just fail the surgery. Which, I tell you, when I took that test, I was having a bad morning. I do have dysthymia, which is sort of a long-term depression. It's not like sort of a low-grade long-term depression. Alright, don't get distracted by this little guy. That's my son. He didn't want me to make a video, I guess. So what to do if you fail? Talk with whoever is running your process. I know I went and talked to her, and I asked if I could get a second opinion. It would probably have to be with a bariatric psychologist, which is what I did. They gave me a list of different psychologists. So I called this psychologist, and you know, I did wait a few weeks or even a month to call him because I was having insurance things at the same time. But then I called him, just picked one sort of at random, called, and it was like I would have to take the test again because the test was the main reason that the other psychologist didn't want to test. I had to check with my insurance company to make sure that they would pay for the test again. My insurance company pays for the test up to 8 times, and you want to make sure that if you have to take this test that your insurance will cover it, because if you're taking this test costs hundreds of dollars, so make sure, otherwise you're going to be left with the bill and that. You know, the most important part, even if you were to fail the psychiatric part of it and, you know, they wouldn't clear you for the surgery, the most important part is to just keep going. You know, if it's what you want and you've made up your mind, then you do it. You know, after I found out, I was really just downtrodden. I was discouraged. You know, I had told the psychologist that I was having a really bad day when I took the test, and he said that that didn't matter. I disagreed. This is just so many interruptions. Yes, so the most important part is to keep going. If it's what you want to do, do it. Even if it takes longer. You know, when I had initially talked to my dietitian after finding out that he wasn't going to pass me with that test, I was really discouraged. I just obviously cried a lot. It was really hard. I took a few days to compose myself and, you know, I'm going to prove them wrong. That's basically my mindset. I need to get a second opinion, and even if I can't get a second opinion, you know, I have to finish this process within the year that I started it. So I was over 6 months out. If I didn't get passed within, you know, 3 months, which I didn't even know I could get a second opinion at that point, then I would have to restart the whole 6 months again at the end of the year. I was like, okay, well, if I have to start it over again, then I will. I decided it's something that I want to do. I'm not going to throw in the towel. If it's something that you want to do, you can do it. And showing your determination, even after someone tells you that you have no willpower and that you can't do it, showing that you are determined to continue on the process, well, that's the biggest step in the right direction that you could do to prove them wrong to themselves and to you. Just pursue what you want to do. Thank you guys for watching. I know that if you're watching this video, you might have something to do with the psychologist test. You might have it coming up. And all I can say is just go into it with a clear mind. Don't take it on or don't talk to someone on a day where you're not feeling well. Schedule it out. What can I say? Pursue. Stay persistent. Go for what you want. You've made it this far. Just a little bit more. Even if it's a lot more, go get what you want. Okay. Alright. Thank you for watching. Deuces, silly gooses.